Hello, everyone. Welcome to Lab Basics or TCM 101. Let's proceed to our first topic, superficial energy circulation. We will continue where we left off yesterday. Why is it necessary to use this energy flow between coupled meridians to balance them? Would it not be sufficient to tonify lung yin using its tonification point, lung 9, and sedate the lung yang indirectly over large intestine by sedating Li2, the sedation point? Here is the answer. The idea of energy balance is that we find excess and deficiency and try to send one to the other. So when we tonify lung yin deficiency with tonification point, energy comes in from the mother of lung, which is the spleen, an organ that has no excess situation. Then we sedate the lung yang indirectly with Li2 sedation, thus sending the excess energy to its son organ, which is the urinary bladder, an organ which is not deficient. While all the time we have the excess and deficiency within the lung and large intestine itself. Does it not make perfect sense to send the excess energy into the deficiency? The only difference is that the excess is in the yang and the deficiency is in the yin. This is why we have to use the superficial energy circulation in order to change polarity from yang to yin, which can be done very well with the yuan source and luo connecting points. A luo connecting point of a yin organ tonifies its yin and the yin of the coupled organ and sedate its yang and the yang of the coupled organ. Example, stomach yin deficiency and yang excess. Diagnosis, gastric ulcer. Symptoms, hyperacidity, burning pain when hungry, intolerance to hunger, excessive thirst, preference to cold drinks. This situation is called stomach fire with yin deficiency and hyperactive yang. So on the tower diagram, you see an imbalanced state in the stomach, too much yang or excess yang, very deficient yin. To balance this, we need to tonify stomach yin indirectly and sedate the stomach yang directly. To do this within the coupled organs, we must use the luo and yuan points. So we have to sedate stomach 42, which is the yuan source point. It will sedate the stomach yang directly and the spleen yang indirectly. Tonify spleen 21, which is the luo connecting point. It tonifies spleen yin directly and stomach yin indirectly. In this process, stomach yang flows into spleen yin and changes polarity. Indication, a luo connecting point balances a one up arrow and one down arrow. Imbalance in an organ. Definition, a luo connecting point of a yang organ tonifies its yang and sedates its yin. Thank you very much for your attention. We now welcome Ma'am Teresita Sumile for the second topic for today. She will discuss local and adjacent points. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector, at sa lahat na po. Local and adjacent points. Dito na po tayo. Ay. Day 1 pa pala. Sorry po.
Okay po.
Yes po. There are many ways to choose points for treatment. One could give needles in the points where pain or other symptoms manifest. These are called local points. One could consider the meridian that passes through the affected area and treat that meridian on points that are away from the affected area. These are called meridian distal points. One could consider the area where the symptom manifests, like in the head, thorax, and abdomen, and use points that are empirically known to influence these areas. These are called general distal points. The symptoms affecting the patient, such as headaches, sleeplessness, diarrhea, constipation, cough, and asthma, pruritus, could be treated with empirical points called symptomatic points. The tissue that is affected, like muscle and tendon, bone, skin, organs, perhaps in many areas of the body, can be treated with special influential points for these tissues. Or, better still, you could combine all these points to give a cookbook recipe treatment. Some acupuncturists treat very few points in the session to bring about a change in the energy imbalance the patient is suffering from. These are called energy balancing points. Okay? A good acupuncture treatment is a mixture of cookbook points and energy balancing points. Most schools of acupuncture seem to concentrate on either one or the other. There is nothing wrong with cookbook or symptomatic treatment except that the results which seem to be short-lived. The patient seems to improve during the treatment period, but the symptoms return in a few weeks or months. The energy balancing treatments, however, are highly successful, but this must be given correctly. And for this reason, one should be able to make an exact diagnosis of the energy situation. These treatments also require deeper knowledge of traditional Chinese medicine and greater clinical experience. Both these take time and are more difficult to achieve, and one cannot ask patients to wait until such a time as one is highly experienced. The compromise is the compromise is to combine the best of both worlds, and both help the patient and learn as you go along. The simple rules of point combination are local points, distal points, symptomatic points, influential points, and energy balancing points. These points are combined together in a session, and the patient gets about 8 to 12 needles in all. There is no need to follow rules to the letter. You do not have to use points of each category in one treatment. Use them as you feel necessary. Okay? Now let's talk about local and adjacent points. Patients come to us with one or many problems for treatment. Most of their symptoms manifest in a particular area. So it makes sense to listen to the body and treat the area of the body that manifests the problem. The points that the problem manifests are called the local points. These need not be acupuncture points, but if there is an acupuncture point in the affected area, this could be used. Sometimes, the affected area cannot be needled. For example, the eyes or a cyst in an inflamed or open wound in a hematoma. Sometimes the affected area could be quite extensive. In this case, we could use 2 to 3 local and adjacent points in one treatment, and even more needles if the affected area is large. If there are many local points, example, multiple joint pains, or if the affected area is extensive, like neurodermatitis, then local points are not used. The affected organ system is treated energetically, like joints, kidney and liver, skin, lungs. Remember, small disease area is the local points, large affected area, only general points. Some local acupuncture points would be very strong energy balancing points, and they may be unsuitable to certain circumstances of energy imbalance. Okay? Yun lang po. Thank you so much for your attention.
Thank you very much, Ma'am Teresita. We now go to the next topic, and let's welcome certified acupuncturist, Ma'am Needs You. Good afternoon, Ma'am Needs.
Good afternoon, Doc Hector and everyone. So, dito tayo sa lump basics, needling techniques, part 4. Okay. So, wind elimination techniques. Let's first take a look at the wind symptoms. Okay. Yung sa first, wind cold symptoms, and then the other one graph is wind heat symptoms. Sa wind cold symptoms, yun yung may runny or black nose, mucus is white, okay? Yung head feels cold, ang patient wishes to cover it, okay? Less thirst, prefers for hot drinks. Urine and stool are lighter than usual for the patient. Yung tongue has a white coating. Tongue color does not change in exterior symptoms. Pulse is superficial sa exterior. And my wind, yung wiry, yung sa pulse niya in character and slow dahil may cold. Yung need to eliminate the wind and gagamit ng tonification technique. Ito naman sa kabilang wind heat symptoms. Ito yung squeezing or painful sinuses, may mucus, colored or with blood. Yung head feels hot. Patient wants to have fresh air. Yung body maybe malamig pag tiningnan mo, hinawakan mo. Maraming thirst, parang parating thirsty siya. Preference to cool drinks. Yung urine and stool are darker than usual for the patient. Yan. Yung tongue has a yellow coating. Tongue color does not change. Only the coating changes. Okay? Yung pulse is superficial, wiry, and fast kasi may heat. And yung kailangan nito ay wind eliminations and sedation technique. Okay? Yun po. The wind elimination technique is performed only on the wind eliminating points. The combination of the correct technique on the appropriate point will bring about nearly instant results. Similarly, if we diagnose wrongly and give the tonification technique when we should sedate or vice versa, the patient will instantly get worse. So kailangan i-analyze natin o diagnose natin mabuti yung patient, okay? Opens to the eyes, sight is and my tears, dry eyes. Ito yung may mga symptoms po. Dry eyes, recurrent conjunctivitis, yan. Blurred vision, optic nerve, atrophy, conjunctivitis, red, painful eyes, irritated by wind, causing lacrimation. Medyo po. Short or long sight, straying eyes when tired, poor adaptation to light changes. Similar to chi, excess lacrimation, sorry po, changing with dryness, okay? Yung pangalawa naman, emotion, anger, and then quickly angry, symptoms, loses control when angry, never sorry po, hindi masyado mabasa. Okay, the next one, irritate, angry when tired and weak. The next is aggressive person. Ito yung aggressive person and loud voices, powerful. The next one is irritable, aggressive if they are itching or sneezing, okay? Cannot show anger, soft voice, but can be angry and tense inside. Always angry, irritable, aggressive to no reason, leaking anger, okay? The last one is flavor is sour. Parang ano to, no? Parang sa liver. Covers sweet sour, cream sour. Maasim. Next, likes meat, salt sour. Okay? Bitter, sour foods worsen symptoms. Okay? All sour food worsen with wind symptoms. Pasensya na po medyo may maliliit, hindi masyado makita. Okay. The next one is crave sour, bitter sour, and dislikes milk. Then the other one is craves all sour, leads loud but sour food. Ulitin ko po Craves of sour foods, but sour foods worsen symptoms. Okay po. The advantage of this technique is that it could be used on any point, whether on a yin meridian or a yang meridian, on a mu or shu points, local or distal point, in an exterior or an interior problem. It increases the heat in this area of or meridian or organ. Yan po, combination of the points. Thank you very much for your attention. Pasensya na sa reading ko.
Thank you very much, Ma'am Needs. Let's now go to the fourth presentation, Earth Element. The concept, part 4. The heart is the central circulating organ and spleen circulates blood peripherally. Okay, we have already discussed the problems that could arise when blood and therefore warmth and nutrition does not reach the periphery. The spleen is another important function to circulate the body fluid, and this includes lymphatic fluid. Edema in a patient can mean two things: elimination problem or a circulation problem. Elimination problem is that of kidneys, but the circulation problem is due to the spleen. In Western medicine, it is associated with the heart. In spleen edema, patient eliminates a good quantity of urine, and yet there is edema. Another differentiating factor is that spleen edema is worse in the mornings, on waking, tends to improve as the day goes on. This is due to the fact that the spleen function of fluid circulation improves with activity and the yang of the day, whereas long hours of sleep will slow down the chi movement. Spleen edema tends to manifest in the periphery, hands, feet, and eyelids. When bad, this could be in the lower arms and legs and the whole face. Kidney edema occurs all over, but is worse in the lowermost parts of the body. For instance, if the person stands a lot, it is in the legs. So spleen edema, poor circulation function. So it has the patient will have normal urine output, worse in the mornings, improves in the day, in the hands, feet, and face, and peripheral edema. With kidney edema, poor elimination. So less urine, worse in the evenings, increased night urination, edema better in the mornings, and generalized or postural edema. Treatment for spleen chi deficiency, bladder 20, which is the bakshu point of the spleen, which improves function. Stomach 40, luo point, tonifies yang, sedates yin, good for edema. Spleen 1, wood point of the spleen, tonifies the yang only. SI3, GB43, tonify heart yang and liver yang, can send yang to the spleen. Avoid fatty, creamy, and heavy foods. Eat cooked meals only. Light evening meals. Spleen yang deficiency, moxa, Ren 12 only. UB20, needle and moxa, back shoe of the spleen. Stomach 36, which is the earth point of the stomach, indirect tonification of spleen yang. Spleen 1 moxa, and avoid cold food and drinks. Foods to improve spleen nutrition: proteins, milk products, root vegetables like potato and carrot. Foods to improve spleen chi: wholemeal grains, well-cooked, watery soups that are warm. Thank you very much for your attention. Let's now proceed to the fifth topic for the day. Let's call on Ma'am Teresita Sumile to continue her discussion of the 8 principles. Good afternoon ulit, Ma'am Teresita.
Good afternoon ulit, Doc Hek, and sa lahat na po. Now let's talk about excess and deficiency. Excess versus deficiency. We have here syndromes of general excess caused by pathogenic factor hyperactivity and deficiency syndromes caused by blood deficiency, Qi deficiency, Yin deficiency, and Yang deficiency. So signs and symptoms of general excess caused by pathogenic factor hyperactivity are fever, high, strong voice, irritability, chest and abdominal pain and distension, severe hot diarrhea, constipation, scanty yellow urine. Tongue is red, greasy with yellow coat, and then pulse is forceful, full, and flooding. In deficiency syndrome caused by blood deficiency, signs and symptoms are dizzy, blurred vision, palpitations, pale lips, pale face, insomnia, irregular or amenorrhea, numbness in limbs. Tongue is pale and the pulse is thin and weak. Next is deficiency syndrome caused by Qi deficiency. Signs and symptoms are pale face, dislikes talking, low voice, shortness of breath or SOB, lassitude, weakness, spontaneous sweating, and the tongue is pale, pulse is weak. Next is deficiency syndrome caused by Yin deficiency. Signs and symptoms are afternoon fever, night sweats, red cheeks, dry throat, 5-palm heat, scanty yellow urine. Tongue is red, slight or no cold. Pulse is thin and rapid. And the last is deficiency syndrome caused by Yang deficiency. Signs and symptoms are pale face, cold limbs, lassitude, weakness, spontaneous sweating, no thirst, clear urine, and loose stools. Tongue is pale, wet, and has white coat. Pulse is weak. Okay? Relationship between excess and deficiency. We have number 1, complex syndrome of deficiency and excess. We have chronic Qi deficiency, gets a wind cold. Another one, chronic kidney Yin deficiency, gets hyperactivity of liver Yang. These symptoms are the upper part of the body is in excess and lower part of the body is deficiency. And this can be seen in patients with hypertension. Then excessive and deficient signs at the same time. Then number 2, true excess with false deficiency. Excess syndrome has similar signs and symptoms to deficiency syndrome. Then we have true deficiency with false excess. So in this syndrome, deficiency syndrome has similar signs and symptoms of excess syndrome. And then the fourth one is transformation from deficiency and excess. Transformation from excess to deficiency, meaning there is misdiagnosis or wrong treatment. So, possibly din yun. Then another cause is hyperactivity of pathogenic factor damages Wei Qi. Then letter B, transformation from deficiency to excess, meaning deficiency of Wei Qi may impair the Zhangfu functions in distributing and transforming, resulting in the production of internal pathogenic factors and manifesting as various excess symptoms. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We now call on Ma'am Needs You for Zhangfu organs. Good afternoon po, Ma'am Needs.
Good afternoon po ulit, Doc Hector, and everyone ulit. So, the topic is large intestine functions po. Okay. Functions of the large intestine, what we call dachang, it governs transformation and discharge of waste. Okay. Yan. Receiving of waste passed down by small intestine, absorbing usable fluids that are passed on to the spleen and kidney, then forming waste products into the stool before discharging it from the body. Okay, dyan yan. It is supported by a down-bearing function of lung qi. It conveys our mental waste. Mental waste ang tawag. Okay? Disorders of large intestine are most of the time consequence of disorders of the spleen. Disorders of the large intestine should be viewed in context with all other organs involved in digestion process. Okay? Impairment of lungs down-bearing function can affect large intestine. Okay? So let's go to relationships. Yeah. Small intestine and large intestine and the small intestine. Small intestine passes waste down to large intestine. Yeah, yan. Large intestine and lungs. Okay. Lungs stand in interior-exterior relationship with large intestine. Down-bearing function of lungs is needed by large intestine in order to convey and transform waste. Okay. Large disorders of the large intestine can be caused by lung deficiency. Functionally, large intestine has a closer relation to the digestive tract and its organ, spleen, stomach, small intestine. Okay. Large intestine and spleen. Functionally, it has a close relationship to spleen. It depends on spleen's function of food transformation. If this function of spleen is impaired, disorders of large intestine can manifest. Okay. Pathology of the large intestine. Okay. Sa excess pattern, there is cold in large intestine, dryness in large intestine, heat in large intestine, damp cold in large intestine, and damp heat in large intestine. Okay. Thank you for your attention, everyone.
Thank you very much, Ma'am Needs. Let's now go to meridian theory. We are still on urinary bladder meridian of foot Taiyang. Bladder 60, location in the depression on the line connecting the Achilles tendon and the highest prominence of the lateral malleolus. Bladder 60 is the meridian distal point of the meridian, especially for the neck and occipital region. Also a good local point for ankle pain and Achilles tendinitis. Bladder 62 is located in a depression directly inferior to the highest prominence of the lateral malleolus, above the joint space between the talus and calcaneus. Bladder 62 is the confluent point of the extrameridian. yang motility meridian. The function of the yang motility meridian is to move the general yang energy of the body into the yin, thereby tipping the balance in the opposite direction. This is a good tranquilizing point and is also used to treat excessive heat or itching, restlessness, and insomnia. Bladder 63 is located on the lateral aspect of the foot, proximal to the tuberosity of the fifth metatarsal bone in a depression anterior and inferior to bladder 62 between the calcaneus and the cuboid bone. Some authors locate bladder 63 between the cuboid bone and the tuberosity of the fifth metatarsal bone. The more tender point should be selected. Bladder 63 can be used in acute situations of the meridian and organs, such as cystitis, prostatitis, and acute sciatica. Bladder 64 is located on the lateral aspect of the foot below the tuberosity of the fifth metatarsal bone. Bladder 64 is the yuan source point of the meridian, can be used for sedation of the urinary bladder, yang, when used in conjunction with kidney 4 luo connecting point. Bladder 65 is located on the lateral aspect of the foot in the depression proximal to the head of the fifth metatarsal bone. Bladder 65 is the sedation point of the meridian and is used to sedate more of the yang of the urinary bladder. Bladder 66 is located at the lateral border of the foot in the depression distal to the metatarsophalangeal joint of the little toe. The bladder 66 is called the water point and the house element point of the meridian and can be used both for tonification and sedation of urinary bladder yang, depending on the needling technique. Bladder 67 is located on the dorsal aspect of the little toe, 0.1 tsun from the lateral corner of the nail. Bladder 67 is the tonification point of the urinary bladder meridian. It not only increases urinary bladder and kidney yang, it can also be used to increase contractions of the uterus. Moxa is used in this case, and it makes an excellent point to turn the fetus in breech cases and can be used on the morning after in order to make sure there had been no fertilization the night before. Just as it is not to be used with a needle during pregnancy for fear of causing miscarriage, it is the best point to be used before pregnancy for increasing the catching possibilities. To achieve this, the best time to use the point is during the first 2 weeks of the menstrual cycle. This is also the last and exit point of the meridian, where it flows into the kidney meridian at kidney 1. Thank you very much for listening. We now go to the last topic for this afternoon, chest painful obstruction syndrome. We go to differential diagnosis. It is important to differentiate chest painful obstruction from other conditions with similar symptoms. So let's start with phlegm fluids in chest hypochondrium. In chest painful obstruction, there is feeling of oppression and pain in the chest that may also extend to the shoulder or left breast. Pain is elicited by tiredness, exposure to cold, overeating, or emotional stress. There is usually history of breathlessness. In phlegm fluids in chest and hypochondrium, there is a feeling of distension and pain in the chest and hypochondrial region. Pain is continuous and is worse on breathing and turning one's body. There is also a feeling of fullness over the ribs and a cough with profuse white watery sputum. Epigastric pain. The pain of chest painful obstruction may sometimes extend to the epigastrium and could be confused with epigastric pain, which is pain originating from stomach disharmony. With epigastric pain, there is also belching, hiccups, sour regurgitation, and other stomach or spleen symptoms, which are absent in chest painful obstruction. True heart pain is not so much a different condition as a further and serious development of chest painful obstruction when there is severe blood stasis over a long period of time. True heart pain is continuous and is accompanied by cold sweating, pale purplish face, cyanotic limbs and lips, a minute or knotted pulse, and a bluish purple tongue. Treatment strategies. In chest painful obstruction, the root is usually deficiency, and the manifestation is excess. It is essential always to differentiate clearly between the relative influence of deficiency and excess in the clinical manifestations. Once a deficiency has been identified, one must further differentiate between deficiency of qi, yang, blood, or yin. Once excess has been identified, one must further distinguish the pathogenic factor involved, for example, cold, phlegm, or blood stasis. It is better to deal with manifestation first, that is, to eliminate the pathogenic factor. This would involve expelling cold, resolving phlegm, or invigorating blood. Especially with herbal therapy, it is better to eliminate the obstruction of a pathogenic factor before tonifying the body's qi. With acupuncture, it is possible to deal effectively with both root and manifestation to tonify the body's qi as well as eliminating the pathogenic factor. In acute cases, one must always concentrate on treating manifestation only, while in the chronic phase, in between acute attacks, one can turn one's attention to treating the root, that is, tonifying the body's qi. Although the three main excess conditions, blood stasis, phlegm, and cold, all derive from a deficiency of yang, this will be discussed separately because they correspond to acute stages during which one must treat the manifestation rather than the root. We will be discussing the following patterns. Full, we have qi stagnation in the chest, heart blood stasis, turbid phlegm stagnating in the chest, stagnation of cold in the chest, liver fire harassing the heart in the chest, empty conditions like spleen and heart yang deficiency, qi and yin deficiency, heart and kidney yin deficiency. Thank you everyone for joining. Hope to see you in our next presentation. Thank you very much.